Hello again. So I'm often asked the question regarding hawthorn, which part of the plant is the best to use? Because the traditional use of hawthorn, and it largely seemed to stem out of the UK in the 19th century, the traditional use of hawthorn for the heart was pertaining to the berries. But then there was some very interesting German clinical research, which began about 50 years ago and has been going ever since. And that shows very, very good clinical efficacy with heart problems as supporting the heart. And by the way, I think hawthorn supports the heart mainly because it's a mitochondrial herb. I think we need to throw out some older concepts so that hawthorn increases the blood supply to the heart and all that stuff. I don't think that's how it works. I think it enhances mitochondrial activity in the heart. So the German research showed some excellent uses for the leaves and the flowers. So what part do we use? We have the berry, traditionally, not much clinical research. We have the leaves and flowers. Lots of clinical research, lots of evidence. So for a while there, I preferred to use the leaves and flowers because, as you know, I have a scientific training and I like to have evidence behind what I'm using. And certainly it was widely used in Europe as the leaves and flowers. And that was further reinforced by what I would have to say was a major blunder from the European Pharmacopoeia. So we had a method for measuring the actives in the various plant parts of hawthorn. Now, these actives, there's flavonoids, and certainly the flavonoids are higher in the leaves and flowers, or highest compared to the berries. But this pharmacopoeial method was for these components known as oligomeric procyanidins, or OPCs. Now, they're similar to the OPCs that are found in pine bark, for example, and grapeseed extracts. And this method, when you applied this method to the berries, you found that they contained negligible levels of OPCs. And I thought, well, there you have it. The berries don't contain one of the key active components. This is a European Pharmacopoeia method. It must be that we have to prefer the leaves and flowers. But as I said, it was a blunder. What they were proposing was actually incorrect. And if you use a more sophisticated method of analysis, you find that there are indeed good levels of OPCs in the berries. Not quite as much as in the leaves and flowers, but still therapeutically relevant levels in the berries. So that kind of caused me to do a rethink, and especially when I was researching the whole topic around hawthorn actives, the berries do contain some other things like crataegus acids, and of course the colouring that makes the berries red, which is anthocyanins, and I think they're of some benefit too. So what I tend to do now is I do the best of both worlds. So if I'm blending up a liquid, I'll usually put the leaves and berries in together. So for example, I have a favorite heart tonic mix now, and it's round about equal parts of Arjuna from the Ayurvedic tradition, Dan Shen from the Chinese tradition, as long as it's not contraindicated because it is thought to have some blood thinning effects. And therefore might be contraindicated from a herb-drug interaction perspective. And then hawthorn berry extract and hawthorn leaves and flower extract. That's what I tend to do. Sometimes I might, in a patient's mix, just put the berries in there and then prescribe them a tablet that is from the leaves and flowers. So the berry liquid in the mix and tablets for the leaves and flowers. And I have a patient who has long-standing atrial fibrillation, and she takes that, and she's well into her 80s now, and she's not on blood thinners. She takes a tiny, tiny dose of propranolol, the beta blocker, a fraction of what is considered a therapeutic dose, and this AF mix I'm giving her with the hawthorn berries. But in addition, I'm giving her the hawthorn tablets. So you can do that as well quite effectively. So sorry, my answer is a non-answer. Which is better, the berries or the leaves and flowers? My answer is we're not sure. Do both. Thank you.